For much of the early 1900s, we faced a challenge with 4 legs, a long tail, and a twitching nose for trouble: rats. Thousands of them had jumped ship from the many vessels that called into Brisbane from around the world. As the rats settled in and thrived in the hot, humid conditions, the department was already busy dealing with outbreaks of epidemic diseases created by Brisbane's inadequate sanitation systems. Human waste contaminated water supplies, flies transferred microorganisms to unprotected food, and unwashed hands caused infections and diseases. In January 1900, the first plague-infected rat was found, and just 3 months later, Brisbane experienced its first fatality, a man working at the wharves residing in Woolloongabba. The man was admitted to the hastily built Combsley Plague Hospital. The patient's house was cleansed and fumigated, bed linen and curtains burned, and an iron stockade was erected around the property and 2 neighbouring houses. Meanwhile, the rats continued to grow in numbers greater than the population, as Brisbane and the state began to suffer even more from diseases such as typhoid, scarlet fever, tuberculosis, diphtheria, and gastroenteritis, which resulted in hundreds of deaths. Before too long, the rat infestation had become so bad they were now officially in plague proportions, according to the 1900 Health Act, and Brisbane would be overrun with rats for many years to come. Recognising the extreme need to control the outbreak, the Department of Health made special efforts over a course of 12 months in rat destruction. At the time this idea was hatched, the department had only 30 full-time staff to look after the health of Queensland, yet 10 people were employed by the department's first health inspectors to become the Rat Gang. The primary purpose of the Rat Gang was the destruction of rats by laying poisoned baits, trapping, digging out burrows, destroying nests, breaking up the habitual haunts of the rodents. The fearless Rat Gang laid over 400,000 poisoned baits in 1 year alone. Were the rats to blame? Many people thought so. Most cases occurred in men whose work took them into areas which attracted rats, such as the wharves and produce stores. When the disease was reported in women and children, an association with rats was generally traced. Further work done by the department through post-mortem and bacteriological examinations revealed the fact that a number of rats were infected with the plague. It's hard to imagine a Brisbane with more rats than people, but that's how it was when the Rat Gang went to work. Thanks to the Rat Gang and the department, no cases of the plague occurred in Queensland for 12 years after 1909. The gruelling task of rat wrangling and eradication rested with the department and the stoic Rat Gang up until 1916, when the responsibility was then transferred to local authorities. Today, the Department of Health still plays a huge role in regulating the pest management industry, something which has kept the Queensland community safe for more than 100 years.